Welcome back to San Antonio Living. Well, being pregnant requires a little extra attention to your health. And with the winter season approaching, it is crucial you get that flu shot on time. Here's why. Hey, it's Tuesday, and you know what that means? It's time for some girl talk. So for you pregnant women, how important is it that you get that flu shot? Well, I came over to chat with Dr. Gonzales, who has some very good information you need to hear. All right, ladies, so here we are with Dr. Evengalina Gonzales. How are you, doctor?
I'm doing well, thank you.
Good to see you again.
Likewise, likewise.
So we're going to be talking to you women who are pregnant because this is important and you need to know about the flu shot. So, doctor, why is it important that pregnant women receive the flu shot?
Well, there are so many reasons, but the biggest one is that when they're pregnant, their immune system is altered. Their body is going through a lot of changes, so they cannot handle certain infections the same way. So pregnant women are much more likely, if infected with the flu, to have severe illness as a consequence of it, specifically pneumonia, respiratory distress. These women get very sick very quickly, and it's not like the rest of us where we're just sick for a few days and feel miserable. They wind up being hospitalized for the severity of their symptoms.
It's double time for you pregnant ladies. Now, you're probably wondering, how is it going to affect my baby? So what is the reality when you're pregnant and you get a flu shot? Do they get affected?
Absolutely, and the benefit is that the hope, when we vaccinate a pregnant mom, we're actually protecting the unborn baby as well for several months, even after delivery. So that's the big thing. If a lady in the third trimester gets the flu, gets infected with the flu, she's now at increased risk for preterm labor, preterm delivery. That baby's going to be in the intensive care unit for several weeks as well. So we're trying to reduce that risk. If they're early in their pregnancy, when they get infected, they may actually be at increased risk for miscarriage. So that's the whole reason behind wanting to prevent those kind of consequences by vaccinating, at the beginning of flu season.
Right. Now, a flu shot has no harmful effect on the baby.
Flu vaccine, specifically the shot, which is a killed virus, has been given to millions of pregnant women for decades with no evidence of any harm to the mom or the babies.
And we definitely want to avoid a flu, especially if you're pregnant. Now, let me ask you this, doctor. In a case where a pregnant woman notices she's getting flu-like symptoms, what happens then?
Well, we kind of educate the patients too. What are we watching for as far as symptoms? We're looking for a fever, anything 100 degrees Fahrenheit or higher, possibly a sore throat, chills, muscle aches. Those are the kind of symptoms that they'll call in with. If that happens, it is now too late to vaccinate them. They've already been exposed to the virus. They've already been infected. So at that point, we go into treatment mode. And so if a pregnant patient calls our office with those symptoms, we actually ask them to see their family physician or an urgent care facility because we're trying to reduce the risk of them exposing all the pregnant women in our waiting room to now this very contagious virus. And there is treatment available. There is antiviral medications available, which if started within the first 2 days of the onset of symptoms, it significantly reduces the duration of their illness and the severity of the symptoms and hopefully reduces the risk for pneumonia.
Such important information. Thank you so much, doctor. Okay, ladies, now you know if you're pregnant, it is so crucial that you get the flu shot. It's not going to hurt you and it's not going to hurt the baby. It's just going to keep you away from getting a flu this winter. Institute for Women's Health, 1303 McCullough Avenue, Suite GL70. Give them a call, 226-9705, online, ifwh.org. Find them on Facebook or on Twitter at #IFWHSA. Shelly, what's happening?